When the foundation started in 2003, those were some of the most difficult days of the HIV pandemic. Prevalence rates were over 40% of the adult population. Over 40% of pregnant women were HIV positive. What was the real consequence beyond, of course, the human impact of illness and death? I mean, hospitals were bursting, was the stigma and the discrimination that came with an HIV diagnosis. So what home-based care was, in addition to the really essential health care that was being provided, because formal hospitals and clinics couldn't possibly reach those people who were ill, it was an antidote to that stigma and that discrimination. It was a form of care from community members, mainly community women, working voluntarily to come to be in close, not just physical contact, but emotional contact. Those home-based care workers also worked with the entire family and community and the neighbors, and they helped start those difficult conversations around HIV prevention. They brought it out into the light. They demystified, they really challenged a lot of the secrecy and the hushed tones that came with that shrouded HIV. Today, it's just as important to have those community conversations around HIV. There is a wide range of supports that home-based care programs still provide. A wide range of mental health support, counseling that happens at the family level, the community level. We still have many grandmothers that are caring for, those children, young kids that were 3, 4, 5 years old 10 years ago when they lost their parents are now 13, 14, 15 years old. That's an entirely different kind of parenting. Livelihood support is incredibly important, connecting people to different income generating opportunities, supporting children and young people, peer-to-peer programs and peer workers as they help young people navigate their lives, still encouraging people to test, that counseling to deal with an HIV diagnosis, and that continuing support to remain in school. Who wants to take a pill for the rest of their lives, particularly young people who are still among the most vulnerable in terms of new infections. Staying on treatment isn't just about access to the medication. It is a really complex psychosocial process that home-based care workers are there for. If you want to look at the impact of home-based care programs today, you only need to look at the response to COVID-19 and how essential that community infrastructure was to providing very essential support, not just medication, but really understanding information, prevention, vaccine support, which we're seeing now. That community mobilization and support is built on the infrastructure that was created during the HIV response. It is a huge and continuing contribution that the AIDS movement has made. HIV is not over. There have been incredible gains that have been made, and all of those gains can be connected in some way, shape, or form to home-based care and home-based care workers. We continue to build our interventions on the backs of unpaid women's work. There is a moral obligation to end that practice and properly compensate and support this work. And if we want to actually end the HIV pandemic, if we want to cut AIDS off at the roots, we need to properly not just maintain support for home-based care workers and home-based care programs, but expand that support and properly compensate people for their expertise, their will, and their continuing effort and desire to want to support their communities. That is our solidarity with them, alongside them as allies and supporters of this work and of their work, and to amplify their calls for change.